Welcome to Genomics Gupshup. Genomics Gupshup is an initiative by Mapmygenome to create awareness about this exciting science of genomics. And in this matter, we bring together experts from allied area of health, longevity, gut health, pharmacogenomics, medical sciences, nutrition, fitness, microbiome research, and more. Please join us as we spread the word about this exciting science, and we are now available on any of your favorite podcasts like Apple, Spotify, Amazon or Google Podcasts. Today we are very excited to have Dr. Harsha Talluri, who is a very well-known oncologist in Hyderabad. Welcome to the podcast.
Thank you, ma'am. Thank you for this wonderful exercise. It's very exciting to be here. Genomics and oncology, we can't discuss them separately. Yeah, it's a day in and day out. I keep encountering these issues, and I would be very happy to discuss these issues in a common language which everyone can understand with the help of your platform.
Thank you so much. So, Dr. Harsha, you've gone to many reputed institutions like AIMS and others, but you are in a field which is, most people come to when they have a problem, right, like cancer. So, what was your inspiration in becoming a doctor first of all, and then why did you end up becoming an oncologist?
See, the decision to become a doctor while choosing MBBS, it was very random. I'm not sure how it will look, but my parents, they're from an agricultural background. All they wanted me to is study well. They have no idea हमें खुद क्या करना है आगे जाके. So they just wanted me to study well.
You studied in Hyderabad?
I studied. My schooling was in Guntur, Andhra Pradesh, and then I got my MBBS here in Osmania Medical College in Hyderabad. While doing MBBS, I was drawn more and more to the human aspect of it, like MBBS. Then उसके बाद मुझे पता चला कि हमें surgery, I'm more inclined towards the surgical branches. Even then there was a moment of not so much clarity. I took a pediatrics post-radiation before, and after a month or so I was not feeling up for it. So then again I moved to AIMS New Delhi for a general surgery post-radiation. It was during my surgical residency. In the initial days of surgical residency, you can only imagine a young doctor from Hyderabad going into a state-of-the-art operation theatre where everything is perfect, state-of-the-art instruments, excellent surgeries happening. You become hooked. You literally become hooked to the technical aspects of it. You literally become hooked to the finesse of the surgery. Then after a few days, once you become used to that, then you start seeing more and more patients in the clinic. You start, my unit in general surgery, it was a unit focused on breast cancer and vascular surgery. So you start talking more and more to the patients in clinics. It's not a single point decision to become an oncologist. I've had my difference of thoughts, but the most striking thing when you ask, I remember, is a young lady from UP. She's just 32-year-old. She came to us with a breast lump in general surgery breast cancer clinic. While talking to her, her only concern was not whether I live or die. डॉक्टर साहब, मेरा छोटी बच्ची है, मैं क्या उसका सब कुछ देख पाऊंगी? आप ट्रीटमेंट तो अच्छे करोगे, आप ये ट्रीटमेंट करने के बाद क्या मैं उसके जिंदगी में सब कुछ चीज़ें उसका शादी वादी देख पाऊंगी? Then I noticed that this is not just cutting out tumors. This is just bringing more patients to life, back to life. So that's what took me to oncology. Every patient's journey, it's very complex in oncology, and once you start interacting with people, then you can't just go back.
That's amazing, but that also means that once you get involved in your patients' lives, there must be a lot of emotional stress that must be also coming to you as well, right?
Yes.
Because when I hear people talk about something, when you hear it once in a while, it's fine. You are empathetic towards that person, but I always wonder how doctors manage the stress that comes with this.
For a person, for a random, for a stranger sitting at a distance, they may think that surgeons are made of steel. They have a very strong heart. They have very strong emotional facade. No, to be frank, no. Every cut I make on a patient's body, every surgery I do, it leaves a mark of the own on my heart as well. We also see the trembling hands while explaining the symptoms. We also see the rolling up tears when we explain the disease. We also see the relief on patient's face when we tell that the biopsy is negative, it's benign. We notice all of that too. And you wouldn't believe, after a complex surgery, usually क्या सोचते हैं कि 8-10 hours of surgery you will leave your आप physically very tired हो जाते हो. You get tired in any other aspect of life. You just go home, sleep like a baby. But surgery, it's not like that. You get so much emotionally connected to that. You on the way driving on the way back to your home, you keep revisiting the steps you did in the surgery. Did I do this perfectly? Did I could I have done anything different? Or even on the bed also, even when you close your eyes, you keep revisiting the moments during surgery. Your body will be dead tired. It wants to sleep and your brain would be racing. So you can't just detach from it. You will learn better to channelize it with time. Your skin won't grow thicker, but you would know where to put those thoughts. You will channelize it better and again to get back to other things in life.
So do you do meditation or something like that, or
Yeah, it would have been very मतलब बोलने के लिए बहुत अच्छा होगा कि मैं रोज मेडिटेशन करता हूँ ये सब बोलने के लिए, but it's not like that. I feel in a sense that my surgery is my meditation. While operating, world shuts out. Everything shuts out. All the worries at home, all the worries back in the clinic, everything else, it just shuts off. You will just become very much focused there, and even though your body gets tired, your mind gets relaxed. That's how surgery.
So while you are doing your surgery, that's your meditation.
Yeah.
That's amazing.
अलग से meditation करना ये सब बोलने के लिए मतलब it would have been ideal to say to patients that I would meditate an hour daily. I don't meditate separately.
No, I agree, because sometimes even I feel that when I'm doing some work and I'm fully engrossed in it, I can see stress on my thing. I find that actually comes down when you're working, and I think that's an interesting facet, right? Like when you're supposed to, be in the most stressful of the thing, it is sometimes.
It's relaxing and it shuts out everything. It shuts out the noise. Noise is what makes us stressed most of the time, and it shuts out the noise.
एक चीज है, आप हिंदी बहुत अच्छा बोल देते हैं. I mean, आप हैदराबाद में गुंटूर में बड़े हुए हो, फिर हिंदी कैसे?
मेरा हिंदी मुझे स्कूल से नहीं सीखा हूँ, किताब से नहीं सीखा हूँ. मैं जब दिल्ली गया था, काफी साल वहाँ पे पेशेंट से बात करते करते ही सीखा मैं. I was there for 8 to 10 years, and I learned my Hindi in Delhi by talking to my patients only. It's not learned by any textbook or anything. So abhi bhi matlab any serious conversation I switch over to Hindi mode rather than Telugu mode. That people might find a bit weird.
No, I think there are more people speaking Hindi, so
Hyderabadi Hindi थोड़ा अलग होता है. मेरा हिंदी थोड़ा अलग है. People realize that also. डॉक्टर साहब आपका हिंदी तो अलग लग रहा है. हाँ जी, अलग है.
आप नको और वो सब परसों नहीं बोलते हैं.
वो सब डिफरेंट. मेरा तो थोड़ा यूपी एंड दिल्ली वाला, पूरा दिल्ली वाला हिंदी हो जाता है.
तो आप जब पेशेंट आते हैं तो what is that one thing that you wish कि लोगों को समझ में आता है कि कैंसर के बारे में लोगों को क्या अवेयरनेस होना चाहिए? When they come to you, if they're coming very late, are they coming early? I guess in your case, mostly they'll come when they need a surgery or a problem needs to be solved. Right? So what is that one thing you wish people knew more before they came to you?
The thing is, not just people, everyone यहाँ पे we visit the doctor when something hurts. Only when something hurts we go to the doctor. But unfortunately, in case of cancer, there are early whispers, not warnings. this disease only whispers, it doesn't warn right away. बहुत ज़्यादा cancers में there won't be any red flag signs apparent, so that you can visit the doctor early when there are symptoms and get it cured. People often come late. It's not because of ignorance, it's not because of their mistakes, it's because the disease per se. The disease whispers into your body. You should align to listen to those whispers, like a breast lump. It will be a very painless breast lump, slow growing breast lump only. The breast cancer lump, it grows slowly and it will be painless initially. And it is at that point you should see the doctor for an optimal cure. Stage 1 breast cancer में we can give 95% of cure rates with a very simple surgery and simple treatments. वो ट्यूमर बड़ा होते होते चेस्ट वॉल का मसल्स को इन्वॉल्व कर दिया, स्किन को इन्वॉल्व कर दिया, दूसरे ऑर्गन्स में चला गया, then it starts paining. Then when the patient comes, the treatment becomes prolonged, difficult, expensive, and with advanced stage, the cure rates which we can offer them are far more inferior. So one thing which I want people to understand is cancer doesn't scream. It whispers certain subtle things into your daily life. You should be able to pick them up, visit a doctor, take the right advice, or get screened. Screening to हमारे country में it's a very low and very strangely misunderstood concept. Like if I suggest screening tests to anyone, आधे से ज़्यादा लोग सोचते हैं हाँ ये तो ऐसे ही बोलते हैं, मैं तो अच्छा हूँ, నేను చాలా బాగున్నాను డాక్టర్, నాకేం కాదు, నాకెందుకు అనవసరంగా ఇవన్నీ చేయించుకోవడం. Fortunately, annual health checkups have picked up a lot. I think annual cancer screening should also pick up to at least to identify the most common culprits early.
So, I mean, we do in part of our genome patri, we have a cancer risk prediction, right? So the idea was that people understand that they have a risk and then they go to a doctor early. Unfortunately, it has not yet become that mainstream. But I think that's one thing that people, if they know that in their family there was a history, that there are chances that there is some genetic component that is there, and therefore they should visit a doctor at least once or get some sort of a cancer blood tests and all that to be at least.
See, scenario is becoming hopeful. I am getting more and more of these questions, exact questions which you have mentioned कि मेरा family में ये है. Whenever the family members visit me along with the patient, they will invariably ask, डॉक्टर साहब हमें कुछ करवाना है क्या, हमें कैसे पता चलेगा. Then at least the opportunistic screening, and that I call it as an opportunistic screening, not the community screening. Opportunistic screening aspect is getting improved. It's improving. And coming to genomics, yes, it is useful for early detection of cancers and also for identifying the persons at risk more effectively, so that I can give options to them. कौन सा टेस्ट कराने से उनको क्या पता चलेगा, कितना फ्रीक्वेंटली करवाना है टेस्ट, ये सब मैं बता सकता हूँ. दैट इज इन दैट वे genetic test does help in early diagnosis and also tailored screening advices to people.
तो आपने कहा कि फर्स्ट स्टेज में अगर ब्रेस्ट कैंसर के लिए आते हैं तो 95% क्योर है, तो अगर वो स्टेज 3 या स्टेज 4 में आते हैं तो वो चांसेस कितने कम होते हैं
approximately? There are very many types of breast cancer and very many types of treatments are available these days, but a ballpark figure, stage 3 breast cancers में cure rates would drop down to 30 to 40%, and in stage 4 previously तो stage 4 तो incurable disease हो जाता है, but unfortunately in certain types of breast cancers even in stage 4 we are able to cure certain number of patients, but that treatment effort takes a lot of effort from us. It takes a lot of commitment from the patients by means of tolerating these treatments, and also a lot of commitment from the family by means of social, financial and all other things. वो सब करने के बाद भी the results are less. So one superpower in oncology is early detection. So you cannot beat early detection in getting optimal results.
Correct, because if you don't know, you're already seeing that from 95 it can go down to 30-40%, right? I think one of the things we often see in India is that people spend lakhs and crores of money after they fall sick, right? And after they are like in such a state where neither their quality of life can be improved nor can they, nothing much can be done. But they don't want to find out that they are at risk for something. Why is this ostrich-like mentality?
Ostrich mentality, that's what it's going through my mind. Like I call it an ostrich phenomena. जो सिर्फ sand में it keeps its head in sand, buried in sand. It thinks everything is all right. I even use this word to my patients. The ostrich mentality, leave it. The thing is, we are culturally more inclined towards denial. हमें कुछ नहीं होगा. नाकेम काल doctor. మా ఇంట్లో ఎవరికి లేదు నాకేం కాదు. That is the most common excuse I listen when I suggest that you should get tested, and the denial, the cultural denial aspect of it, and the thing is, अगर कुछ करवाएंगे तो कुछ बाहर आ जाएगा. We will have to roam around the hospital. No one wants to hear a bad news. Our brains are tuned to that, so no one wants to hear a bad news. For celebrations, for auspicious things, we spend lakhs and crores of rupees happily on the things which bring us good news, good vibes, good things. A screening test, it can bring a bad news. It's up to you to look at it as a bad news or a potentially good news.
Good news, yeah.
Okay, it's like looking at a glass half full, saying that आधा तो पानी है, नहीं आधा पानी नहीं है बोलने का. So people don't want to spend money on screening tests because it can potentially bring bad news. That's why they don't want to spend.
It's the same thing like life insurance and this thing. Initially, I think, long time back, I think they used to call it the death insurance. And people didn't want to spend on it because it meant that
Fortunately, we crossed that barrier, I believe.
Yeah, we have crossed that barrier. So I think we have to do something similar for awareness and.
Yes, even cancer के लिए awareness, the scare. It is. Why would anyone become scared of cancer? Because they would regard cancer as a death sentence. Earlier, it was regarded as a death sentence. That's why people are very scared. We don't take names of anything. It's like आपने Harry Potter पढ़ा होगा तो then the villain Voldemort को तो बोलते नहीं है. Everyone will call he who must not be named. It's like cancer in our medical terminology. No one would like to utter the word cancer. No patient, no other doctors. They would want to utter the word cancer. Patients हर रोज बोलते हैं डॉक्टर साहब वो तो नहीं है. डॉक्टर साहब वैसी बात तो नहीं है. अदैते काद गदा. So is it not that करते they don't call out the word cancer because they're scared about it. Rightfully so. Previously it used to be a death sentence, but not anymore. With early detection and with targeted precise treatments, precision oncology, we are able to cure very many of them. Or else we are able to extend and manage the disease like a diabetes or hypertension. Chronic disease बना के manage कर सकते थे काफी सारे cases.
So I think आजकल they are saying that cancer is a metabolic disease, right?
Yes.
And I think one scientist, I think Dr. Bharadwaj, he said that diabetes is a disease of the brain because you are tempted to eat and you don't exercise and things like that. Similarly, I think the cancer is a disease which is a more
lifestyle. Yes,
lifestyle.
Cancer is becoming
also
more of a lifestyle disease as well. The common perception about cancer people have it being a genetic disease. Cancer का genetic basis ही सोचते हैं. Even people when they come to my clinic they ask कि डॉक्टर साहब हमें क्यों हो गया, हमारे फैमिली में तो किसी को है नहीं. But mind you, the familial aspect or the genetic backing aspect of it comes only to 5 to 10% of cancers. Rest everything is sporadic, and it's the epigenetics. Rather than genetics, the epigenetic traits also play a lot of major role. I used to hear it back in my days of training from my seniors, like the genetics it loads the gun, and it's the lifestyle and the environment fires the gun. So even with a loaded gun, with proper precautions, you can keep it safe.
I agree. I totally agree. I think we use that often in Mapmygenome because
I used to hear it a lot, and it got connected with me. Yes, it's exactly the same. The environmental triggers, they load that gun, they fire that gun. So
because initially I remember we started Mapmygenome in 2013, and I think at that time it was we didn't understand why are we even helping people understand risk of a particular disease when it hasn't come yet. So we will often tell them that the reason we are telling you this is for early, so we say that genetics is loading the gun. What you do today will save you from the future problems that might be there. But I think it took a while, but I think now people started to understand, okay, this is what it means.
Yeah, most probably, आपका ही वो words has distilled through people and reached me.
I hope so.
That's a great thing. So those words got connected very much to me. Like cancer में, even if you have a genetic, it's not a bad idea to know your genetic risk beforehand, before you develop anything, because that way it will empower you to get personalized screening recommendations. We can offer better screening tests, more precise screening modalities, or more precise even surgical modalities to reduce the risk of cancer. So as we all must have known कि Angelina Jolie effect, जो उनका genetic टेस्ट जब पॉजिटिव आया, उन्होंने प्रिवेंटिव सर्जरी करवाई, that drove a lot of awareness. We need to share more such stories to bring to reduce the taboo about genetic testing in preventive oncology. In therapeutic oncology, it has become a part and parcel. In pharmacogenomics, it has become a part and parcel. In preventive oncology, the role of genomics we should desensitize more and more people towards getting one.
I think, and interestingly, I think it was the same year that we started Mapmygenome. I think it was that Angelina Jolie effect around that same time. And I think half the time we were trying to explain to people that no, you don't have to do a mastectomy. That has to be, that's a different. There is a multiple risk. And only your doctor is going to do that. This is not something you do when you just have a risk for something. Right? I think the idea was really that can we help people to understand that there is a risk. Then if you have a risk, how do you discuss that with your doctor and then take the next steps?
So regarding genetic tests also, I would like to add there is a confusing side to it as well. It has to be the genetic test before getting one. It has to be done with a proper consultation with the doctor and a pre-test counselor. A genetic counseling session should happen so as to what to expect out of the test and what to interpret out of it, what all the possibilities we might get before getting a test done, rather than randomly getting a test done and bringing the results to me.
Correct. No, I agree. So we used to do, when we were talking about like many years ago. So earlier we get, someone I got a high risk for lung cancer. Right? So the wife called me and said, I knew it. He was coughing at night. So I said, no, that is not a sign of any risk. It is just a risk. And cancers, I think, do your counseling session first, and then have don't get worried about a risk. That's a risk factor. Just like obesity is, just like age is, just like cigarette smoking in lung cancer or otherwise. In fact, I often tell people that cigarette smoking is probably a worse thing than having a genetic risk.
Yes.
Right? So there are many risks that are more problematic than genetics. But genetics is something that is good to know because that won't change.
Yes.
Right? So
that's a non-modifiable thing. So that if we have a non-modifiable risk factor, we should be more careful about the modifiable risk factors, modifiable factors of it.
So now you mentioned also pharmacogenomics, you mentioned clinical testing and all that. So for the average person who comes to you, let's say they came to you with a particular diagnosis, or what are the normal genomic tests or other tests that you recommend? And I know this is a very generic question because I think it will depend on the patient and their condition.
So I would like to simplify an answer. Whenever I mean to explain a mutation to a patient before offering a genetic test, उससे एक क्यों डॉक्टर साहब? तो mutation I would explain like a spelling mistake happening in your genome, which is translating into a bad word like cancer. That spelling mistake in the genome, if it's a properly worded sentence, normal lifestyle happens. If that spelling mistake in the genetic code happens, it translates to cancer. We are trying to do a test to identify those spelling mistakes. Those spelling mistakes, there are very many roles our genes play. Usme, they will help us in diagnosing and in few cases even in treating. Like in the case of lung cancer, we cannot treat adenocarcinoma lung without getting a panel for it. We need to identify the driver mutations first, and the entire course of treatment, prognosis, and their entire treatment journey is going to depend on that. So it has become such an important part and parcel. And these days, unfortunately, we are seeing more and more young breast and ovarian cancers. In all those patients, we get a hereditary breast and ovarian cancer panel done to identify the genetic mutations, the somatic mutations, if there are any. If there are any inheritable mutations found in the patient, we will be able to identify those risks in the family. We will be able to better equip them to face what might come. They are at around 20% more risk than the other average person to develop these cancers. So that they can take the precautions like high risk screening. So ट्रीटमेंट प्लान करने के लिए कुछ टेस्ट तो पार्ट एंड पार्सल हो गया है कैंसर ट्रीटमेंट में एंड फार्माकोजेनोमिक्स few cancer drugs works better for few patients and they will work only when those mutations are there and in that aspect it also has become a daily driver in clinical practice of oncology.
So एक तो आपने बताया कि जो फैमिली हिस्ट्री में जो फैमिली में है so your hereditary hereditary टेस्टिंग और एक आपने बताया सोमैटिक टेस्टिंग तो मतलब वो जैसे सडनली आपके बॉडी में कैंसर सेल्स डेवलप करते हैं सो यूजुअली सोमैटिक के लिए आप ट्रीटमेंट के लिए यूज करते हो कैसे यूज करते हैं
सोमैटिक टेस्टिंग वी यूज फॉर ट्रीटमेंट्स जर्म लाइन टेस्टिंग वी यूज इट फॉर when we find a somatic mutation we check whether it is a germline one, it is an inheritable one or not. There is a mistake happening in the genome in the tumor cell which is resulting in the development of a cancer. That need not be an inheritable one. That could be a one-off abnormality developing in a patient because of the environmental stimuli or any other stimulus causing it. So उसको हमें आइडेंटिफाई करना है कि वो is it inheritable? If it is inheritable, then who all are at risk? किससे हम टेस्टिंग स्टार्ट कर रहे हैं? We always start with the index patient and then counsel the family, immediate family for the further genetic testing.
So index patient मतलब
जिसमें actual problem है.
फिर उसके when you say other family members, who would those be?
First line relatives, first degree relatives, immediate family, like what we call
mother, father,
माताजी, पिताजी, भाई, बहन, बच्चे.
So I think especially in oncology there are lots of both therapeutics as well as diagnostics that have come up in the last few years. Therapeutics may be a lot of FDA approved like biomarker based tests that are there, drugs that have come up. Are all of those available in India? And if not, which are the ones that typically are available in India today?
See, we are evolving Indian genomic databases and Indian genomic tests are evolving a lot faster in the last few years compared to the last decades. So majority of the tests used to be available only in the Western population. Majority of the genomic databases are available mainly for the Caucasian population. We are making inferences mostly based on those databases earlier. Nowadays, Indian genomic data is also and Asian genomic data is also becoming more and more stronger. And also regarding tests, in this day and age, I wouldn't say anything which I can't offer to my patient which will be offered to a patient in the US. ऐसा तो कोई टेस्ट है नहीं. अगर यहाँ पे नहीं होता है तो sample will be sent there. We will offer the test. The treatments are uniform. The guidelines are uniform. Like tests like Oncotech DX, if you have came across to predict whether risk of recurrence, whether the disease is going to recur or not, whether chemotherapy we should give or not. These tests are available in the Western world mostly.
They're also available here. It's just that
we need to send the samples there and all these things.
I think they can be done in India.
Okay.
I think it is just that that branding has not
branding
been
yes,
done.
yes. It's all the IP.
But the good thing I think I've seen over the last 10 years is that today we are seeing that many of the tests earlier that you sent for lakhs and lakhs of rupees, today most of them are done.
Kudos to the companies like Mapmygenome and all who are bringing genetic tests to India and our population more and more accessible to our population.
But my big worry in India is that we are constantly trying to reduce the cost, which sometimes
without losing the quality.
Yeah, and I think that's where the problem is, right? Not everybody is doing it with quality, right? So I think that's the challenge that we will have to solve, because there are companies that do it well.
It's the challenge in every sphere of life. Here in India, it's a challenge we face in every sphere of life, and we may not control it very well in every sphere. Like it is not in healthcare. It becomes very controversial. It comes to electronics management. Few people want a good quality product regardless of the cost. Few people would want a affordable product. मैं 2-3 बार खरीद लूँगा. Regarding healthcare, it is not like that. You cannot do it twice. You cannot do it cheaper version twice. So even while suggesting treatments also, few things are costly, and it is unfortunate that the quality gets some cost. But वो हमें अच्छी तरह if we explain people better, then no one would be मतलब health के बाद ही कुछ. It is the lack of awareness which prompts to take bad decisions, choose bad products or choose bad treatments. Is the lack of awareness. If you counsel them, empower them enough, they will choose quality products. Yeah, everyone wants their health as their priority.
Correct. You live only once, so
yes.
you can't be cheap.
फोन तो 2-3 बार खरीद सकते हैं. ये वाला नहीं चलेगा तो दूसरा वाला अच्छा चलेगा, तो it balances out. Health ऐसा नहीं है.
I think that's a very important message you told everyone, that you can't just say that ये सस्ता वाला try करके फिर दूसरा वाला try करेंगे, because you just don't live twice, right?
वही मतलब even to the drugs also, मतलब there are multifaceted arguments to it. मतलब मेरे हिसाब से मैं अगर अच्छे कपड़े पहनना चाहता हूँ तो मैं अच्छे दवाई खरीदना चाहूँगा, अच्छे जगह पे टेस्ट कराना चाहूँगा, अच्छे ट्रीटमेंट लेना चाहूँगा. I can't. I would want to wear a good shirt and I would skimp out on my health. I can't do it.
And I think that's something that hopefully that awareness will be there, that will continue. So हर साल there is cancer awareness programs, right? I think we often see there's a cancer day, there is all of that.
This very month is a breast cancer awareness month. October is a month of pink.
So how can, what in your mind we should be doing for this cancer awareness month? Of course, part of what we are doing is also awareness and something that we are doing. But is there something else that we can do? I mean, you also suggested, somebody like, celebrities help in that. But what else can be done?
Desensitizing the word cancer. Desensitizing the negative aura around it. Desensitizing people so that they don't run away from the diagnosis. Desensitizing it so that they don't shy away from getting screening tests done. So हर साल मतलब we started a few years back only on World Cancer Days and this breast cancer awareness month. We call our patients who has successfully completed this journey. They are our ambassadors. मैं बोलूँगा तो 10 लोग सुनेगा, अगर मेरा पेशेंट बोलेगा तो 100 लोग सुनेगा. So we call our heroes forward. We make them talk about their journey to the fellow people, to the fellow patients who are ongoing the journey, to help them fight better, and also to the community. I would want to bring more and more people who already went through this journey to talk about it, to raise awareness. Awareness मतलब कुछ नहीं है, तो you remove the negative feelings around it and you say that this is normal. मैंने ट्रीटमेंट खत्म कर लिया, मैं अपने लाइफ में वापस आ गया हूँ. ये बात अगर एक पेशेंट, एक वॉरियर ने बोल दिया तो it would bring a positive change in hundreds and hundreds of lives. And also अगर I went through all these side effects, ये सब मैंने ऐसे cope up किया, cancer support groups, those help a lot. Those are the kind of efforts which I want to make in improving treatment journeys.
Yeah, no, I agree. I think when a patient tells their own story, it is helpful. But I think, given to that, I think there are also a lot of people who spread wrong things, right? I mean, I think that has become in the age of Instagram and TikTok.
Sensationalism and viralism. Yeah, even people who are to be responsible, very much responsible, like celebrities, they are focusing on only the short-term publicity aspects of it. I don't want to take names or take instances. Very famous celebrities misguiding people about their cancer journeys, and that would potentially demoralize or desensitize people from getting actual treatments. When the very doctors who have treated them are coming forward and saying that आपने तो ये treatment लिया है ना, इसके बारे में तो बताओ. वो तो unfortunate, very unfortunate situation that is.
I think that's the challenge today, that people don't tell the whole story.
Fear and sensationalism, they drive content. आप किसी को डराओ कैमरे के आगे, वो वायरल हो जाएगा.
Yeah, but educational
these things are boring.
Yeah.
Who would listen to an oncologist talking about educational videos for an hour? No.
Let's see, maybe they will.
Let's hope so.
Actually, we have seen, at least in genomics Gupshup, at least I've seen that a lot of our oncology videos actually become very popular. So maybe there is interest. Maybe there is just
maybe there is interest. Maybe the fear of oncology is driving people to. Only fear, unfortunately, only fear is driving people to listen to good quality advice as well. And even social media advice देखूँगा तो it's only fear which they are causing fear of certain microplastics करके, Teflon करके, aluminum करके. It's not the single things which are increasing the cancer. It's the collective lifestyle changes which we are bringing as a society. Young people these days, in the ages where unfortunately cancer is becoming more and more common in young people, in the ages where they should be planning their weddings, they are planning their chemotherapy schedules. That's the most unfortunate thing we are seeing in the day and night. We are eating fast, we are working fast, we are trading our health for the hustles, and unfortunately we are paying our prices for it. So rather than focusing on fear-mongering things like ये करने से cancer होगा, ये करने से cancer नहीं होगा, focus on a clean life, a balanced life. It is boring, but it is the most effective way.
If you want to live long.
Yes.
I think.
मैं यही बोलता हूँ पेशेंट्स, मतलब हर बार पूछते हैं कि मतलब कुछ पेशेंट्स का लाइफस्टाइल ऐसा रहता है they have lived a more ideal lifestyle than me, than my parents, than everyone else I know, and still they got cancer at an elderly age, but there are innumerable factors for it. But वो लोग पूछते हैं डॉक्टर साहब हमें क्यों हुआ, या कोई लोग पूछते हैं वो तो मैं तो 40 साल से सिगरेट पी रहा हूँ डॉक्टर साहब, अभी तो कुछ नहीं हुआ, 10 साल 15 साल और बचेगा मेरा लाइफ, तो नहीं होगा शायद कुछ. So the one anecdote I want to give is, you walk in the center of a busy highway. You may not get hit this day, you may not get hit the next day. कभी ना कभी तो एक्सीडेंट होगा, एक्सीडेंट होने का चांस आपके लिए ज्यादा है. अगर आप in the center of highway if you walk on a footpath, your chance of getting hit is way less. I wouldn't say it's zero. In the factors beyond your control, you can get hit with a vehicle and you can be in an accident. But the probability of you walking to a longer distance will be more if you walk safely on a footpath rather than walking in the center of a highway. So don't count on exceptions. Don't try for magic fixes. Don't try for miracle cures. Focus on the old boring aspects. You will be fine.
So don't trade health for hustles.
Yes.
And don't get into the highway of hell, if I will, because ultimately I think you are, when you are aware that if you want
simple.
to.
You don't have to hustle. You live longer. You live a productive life. You will reach you will reach far in life.
And I think there will always be exceptions. That uncle who drank every day, or there is that person who was very clean and still had cancer. But I think those are exceptions. They are not the rule. So I think the statistical average for majority of the people will be, one, get screened early, and two is to lead a more heavier lifestyle.
Yeah, moderate lifestyles. Don't do any extreme things. Anything in extreme is not good.
So what would be your top 3 lifestyle recommendations for?
Lifestyle recommendations would be to move more. We are sitting and sitting. We are sitting to work. We are sitting to eat. We are sitting to relax. We are sitting to pass time. We are sitting. We've been sitting.
Yeah.
So sitting and sitting. More sitting we are doing. So we should change that. We should move more, not just for fitness, even for cancers. Obesity and insulin resistance and metabolic syndromes, they drive cancer genes, cancer epigenetics, and it is directly linked to almost 13 types of cancers. I'm sure that number would be increasing as more and more research would be going on. 13 different types of cancers are related to obesity. So I would want everyone to move more and eat wholesome foods rather than miracle cures and fast-paced diets and magic pills. Eat wholesome foods, natural foods, move more, and rest well. Do prioritize rest. It's your duty to take care of your body. It's the paramount duty to your family, which you can do is to take care of yourself.
So sleep, exercise, good food, clean food.
That's all.
And that is, I think that's reality is that for most of health, I think that's that is the
tasty food often. Good food can be tasty, but bad food is always tasty. So please pay attention to what we inhale. What ends up on my OT table? Things we eat, things we drink, things we inhale, and things we ignore. These are the things which end up on my operating table. So don't do that.
So, but how do they prevent the inhale part, right? Like if they're living in Delhi, for instance, or
that's the unfortunate thing of it.
I mean, I use a lot of air purifiers and all.
We try everything. We try air purifiers. We try masks. Even vehicles are getting air purifiers. Government is taking certain measures to curb pollutions, but it's the collective effort as it's a overcrowding is what hampering certain decisions.
So I just wanted to ask you, I think we already mentioned, we already went through this a little bit, but in terms of the kinds of genetic tests that, I know there are many types, but if you can just list out, like there's a pharmacogenomics, there's a initial like a screening test, like a polygenic risk score, HBOC you mentioned, you also mentioned some somatic and other testing. What about like the microsatellite and then the
for colorectal cancer and for endometrial cancer, these days guidelines suggest that, NCCN guidelines also suggest that all of the colorectal and endometrial cancers we should screen for microsatellite instabilities. Microsatellites are these repeating sequences of genes in the end of chromosomes. उसका length अगर हम measure करेंगे तो हमें वो we can identify the burden of mutations in that gene, in that particular chromosome. So microsatellite का length unstable है तो हम we can say that there is a mismatch repair का deficiency है, genomic repair का deficiency है उस person में. So these tests has to be done in certain cancers like endometrial cancer and colorectal cancers. We are all recommending previously MSI testing. We used to do it with IHC, MMR by IHC we used to do as a part of histopathological examination. These days we are more and more inclining towards getting an NGS panel. It is more accessible, convenient, and giving more answers in a single shot.
That's good. So, and what about just last question, which is technical? So there are lots of new types of therapies that have come up, right? There's obviously the surgery that you do. There is chemotherapy we talked about. There is also immunotherapy and there's CAR T cell and all of that. Is that something that has become popular, or there's still more work to be done?
There is definitely more work to be done, but these times we live in oncology are becoming more and more exciting. Like I mentioned, the stage 4 lung cancer adenocarcinomas, which would have been a death sentence years before. With the advent of newer, more targeted therapies and immunotherapies, they are being managed like diabetes or hypertension. You just take tablets and you live longer. And thanks to the genomic testing and few immunotherapies, they are changing way in the treatments are planned. I would like to say that AI, genomics, and robotics, these things are what going to drive the newer advances in cancer treatment. Because now, as per surgery, anatomy to change nahi hoga. We don't change our body. Our understanding of cancer becomes better and better. Our tailoring of the surgery becomes better and better, and the tools which we use for it are becoming better and better in terms of robotics and more ergonomic instruments and more facilities, more allied specialties supporting our surgeries. That is one thing with surgery. For medical oncology per se, the immunotherapy, targeted therapies, and genome-directed therapies, they are far more exciting.
Absolutely. So I think there's still a lot that will be happening. I think I want to move to the.
Before that, I know this is your podcast. You are meant to ask questions. So I would like to ask you one or two questions.
Sure, please do.
So what made you take a leap into the genomic journey way before like all these newer advances happened?
So I think I got into genomics in 2000, and this was the time when the human genome was just getting completed. We said, okay, this sounds interesting. I think in some ways, we have T-shirts that say "Curiosity is in my DNA." So I guess that was
Curiosity
much. Yeah, curiosity drove me. My background is in physics, so it was not a natural thing to get into. But I think we got in. We first got into the first company was called Ossimum Bio.
Okay.
And there we then ended up acquiring a lot of companies in the genomics space. GeneLogic was in the US, a very well-known company, and then a couple others in Germany and Netherlands. So we are doing a lot of work, both with the FDA, the EPA, all of that, and 50
we are
of the
focusing all those work to improve the genomics scenario in India.
Yeah, so we did all that. We worked with most of the pharmaceutical companies, and then I felt that this is not helping my average person next door, right? Like, can these technologies really help somebody? And so in 2013 we started Mapmygenome, and today I think we started first with the consumer, and I think because there was a need to create that awareness. But today we have a CAP accredited and an ABL accredited clinical lab. We do all the tests like exome sequencing and many other tests that are there that we just talked about, pharmacogenomics and others, along with the consumer tests. But I think that's one thing that not everybody knows.
Yes. Genomics is my favorite, my very interesting topic. Genomics and familial cancers are one of the things which I was very much drawn to while studying oncology and while practicing oncology also. That's where it gets me more curious about this stuff.
So you need to wear a t-shirt.
Yeah, definitely.
So I think we've gone through a lot of like technical details and all. We want to know who the real Dr. Harsha is. When you strip him of the oncology piece, right? I mean, of course, that's a very important and what most of us will relate to you. But I think I want to know what is that one thing that your patients will be surprised to know that you do outside of treating them.
While treating them, I may appear to them as most organized, most calm, and most planned person. But once I come out of the hospital, I will be a completely different person. OT में तो मैं 10,000 बार चेक करूँगा कि everything is in order, everything is ready, कुछ मिस नहीं होना है, कुछ टाइम वेस्ट नहीं होना है, हमें ऐसे ही चलना है. 1000 बार मैं इंस्ट्रक्शन देता हूँ. When I come home, I can't even find my own socks. And I go home, I just prefer a quiet time with 3 or 4 of my favorite people around, and
so that's what you do after you come back home.
Yes.
And relax.
And I have.
Do you watch movies?
Rather than movies, I used to read books. Harry Potter is my favorite series. I read them like 1000 बार भी पढ़ लूँगा मैं. I remember all those lines. I still go back and read it. It's like I don't know. I find differences in my real life to the characters and lines there.
So clearly you don't relate to Voldemort. He must not be named. So who do you relate to in the Harry Potter books?
I like Ron and Harry Potter. Both these characters a lot. I relate their references and all the. I relate the entire series to my life, and also I have I derive satisfaction and fun. I collect fountain pens.
Oh, wow.
Whenever I feel stressed, I just I go, I try new pens, I clean them, I try new inks. This may feel weird, but I feel I get my सुकून मिलता है मुझे वो करने से.
That's really amazing. Actually, I think I have one really old fountain pen. Maybe I should find that for you.
Old, new, everything. I like everything about fountain pens.
And do you use the ones that you have to dip in?
Dip pens, yeah. They're fun to use, but daily practice में तो use नहीं कर सकता हूँ. Daily practice में I have a
prescription में आप
I
fountain
use
pens
fountain pens every day.
That's very interesting.
Every day since many years I've been using it.
Okay. So finish the sentence as quickly as you can. The best thing you can do today to reduce your cancer risk is
Move more.
movement.
Rest more. Move more, rest more, and eat mindfully.
That's great. So I think एक university है that has been spreading around lots of stories like called WhatsApp University.
WhatsApp University.
So how do you react saying that ये तो मैंने
मेरा
WhatsApp?
तो पूरा it triggers me a lot when I hear people say that people क्या मेरा father किसी कोई भी बताएगा अरे हमें तो WhatsApp में ये बताया कि करके अगर WhatsApp कैंसर को क्योर कर सकता है तो I would have been out of my job. Majority of my colleagues are would have been on streets, right? So if it can cure cancer, if a forward can cure cancer, it's not like that. You can't trust every information shared randomly. There is a sea of misinformation. There is a sea of misleading information. There may be a drop in that ocean where good advice can get circulated, but majority of it is noise.
So
It's very triggering for me.
I can imagine. I think if even for me, even though I'm not doing actual treatment, I think it really bothers me when I see those forwards. But other than, let's say, WhatsApp forwards which are made, do you find today AI-based like stories also that come to you, or do you also see Dr. Google and Dr. ChatGPT?
Yes, more frequently. I used to see Dr. Google more frequently. Nowadays, I'm seeing Dr. ChatGPT more frequently. So Dr. ChatGPT's second opinion, everyone gets a second opinion from Dr. ChatGPT. Even I ask them to get a second opinion for your treatment. Unfortunately, cancer treatments are very complex. They need to be tailored to the patient. And when we tailor those treatments to the patients, they have some concerns. I openly tell them you get a second opinion. And more often than not, the second opinion is from a ChatGPT doctor. The thing is, AI is a very valuable tool if you know how to use it properly, and if you want to use AI in your health, obviously take a doctor's advice along with it.
Yeah.
Okay, let the doctor hold your hand while navigating through AI advices. You bring forward all, I say, I will patiently listen to all the concerns and advices they bring. I will say, you write the points which you want to discuss, we will discuss. But please don't take any decision without discussing with me.
Don't take any treatment decisions.
Yes.
Which is the most bizarre treatment?
Bizarre treatment
That they might have done. Like someone has told you about. Like not something that you do. It's what patients do.
Bizarre treatments तो बहुत सारे होते हैं. Like there are these, some people go to Shimoga, the place in Karnataka, very famous for alternative medicine and oncology. They go and take some packets based treatments there.
Packets?
They give some packets of treatment, and they just have to consume it and they get better. Like for what cancer? For every cancer, sir. कैसे होगा? हर कैंसर के लिए एक इलाज कैसे होगा? Cancer is such a heterogeneous disease. If you just start to understand, get to understand it, it's a very heterogeneous disease. Even breast cancer is not a single disease. There are very many types of breast cancer. Especially with these newer molecular fingerprints, we are identifying types and subtypes of cancers. We are personalizing treatments. It feels bizarre to me to address that. हाँ, उनका कैंसर था वो ठीक हो गया, मेरा कैंसर है मैं ले लूँगा. उनका क्या कैंसर है भाई? उनका कौन सा कैंसर है, उसके लिए क्या ट्रीटमेंट लिया उन्होंने, उनका कौन सा एज में हुआ, वो सब डिटेल्स. उनका भी कैंसर ठीक हो गया, मेरा भी ठीक हो जाएगा. That I find very bizarre.
Has anyone done a study on that?
Studies. India is far more. I cannot really comment on that. Studies तो कुछ होगा नहीं. But I only if anyone asks me about it, I frankly say that I don't know anything about it. And just to keep myself clear, I might be seeing only the bad side of it. अगर उन्होंने कुछ ट्रीटमेंट लेके अच्छा हो गया तो वो वापस तो मेरे पास आएगा नहीं. बट जो लोग वापस आ रहे हैं ना, वो बुरा होके ही आ रहे हैं ना, तो I know the bad side of it very well.
So can we do a study where, let's say, you and a collaboration of many other oncologists, where we take these people, at least the ones who come back, right? That means they have a problem still, and see what has changed in their life. I'm just thinking of a research outcome, because I think people need to know that,
rather than research
I think people
outcome,
rely on hope, and I think those packets represent hope from them in some form, right?
Yeah, ठीक हो जाएगा.
ठीक हो जाएगा. But I think we need to also expose that these might
hope
not.
Hope is good, false hope is bad.
Exactly.
While starting treatment only, both the family and the patient and the caregivers around them, they should be counseled about the likely scenarios, likely treatment modalities and all those beforehand only, so that they can plan their treatment journeys. So I'm not sure that you cannot buy back time here. So अगर कोई बुरा हो गया आया तो we may not help them the way we would have before.
So I know you mentioned in our conversation before that you like to go hiking around. Do you tell people that you're a doctor, or because then they'll bother you if you go?
I mean, not bother me. People तो बोलते हैं आप डॉक्टर जैसा लग भी नहीं रहे हो. Even someone here also mentioned that आप डॉक्टर जैसा तो लगते नहीं हो. I will cherish that.
So I think that's great. I think I even in the fun part we went back into some of the treatment thing. I think that's I think we went back over there, but I think that's necessary. It's important to be able for people to know what actually happens. So clearly, I think turmeric and all that also are problems that you must have come across.
कहीं पे कुछ study था, which is a preclinical study, not in humans. Animal studies saying that curcumin has anti-cancer properties. Curcumin is a turmeric derivative. That study was done in animals, not in humans. So we extrapolate that data so much that eating turmeric cures cancer. It is a very much extrapolated thing. कितना खाना है? How much turmeric you should take? For what cancer you should take? You should drink it, or you should mix it in water and drink it, or you should eat it like that. You should, you know how turmeric is made, right? From a tuber, it needs to be boiled and then made to powder before processing it. I come from an agricultural family, so I know all the process in preparing turmeric. So you should boil and make it a powder, or without boiling it, you should make a powder and then consume. What is good? You should eat the raw turmeric root. No one knows. So, and इतना सारे turmeric खाने के बाद there are certain factors in turmeric which are toxic also. Your liver goes for a toss. So don't regard these things as magical cures. It's a good thing. It has some antioxidant properties. Include it in your diet in moderate quantities. Regard it as a preventive aspect or a healthy dietary aspect of it. I'm okay with it. Don't treat that thing as a miracle cure.
So there are no miracle cures.
No miracle cures. No shortcuts and no miracle cures.
No shortcuts in health. I think you have to eat better, sleep better.
Unfortunately, there are no miracle
cures. And go to a doctor quickly.
Yeah, go to a correct doctor.
Yeah, that is another thing. So thank you so much. I think Dr. Harsha, this has been an absolutely enlightening chat with you, and thank you for coming here to Mapmygenome.
For having me, and it's a wonderful platform here to bring about the doctors and asking their insights and sharing their insights with all the people. And
thank you again, and hopefully we will have another chat on something else. Thank you so much.